Yes, good afternoon, ladies and gents. I think we can start on time, and it's a sincere pleasure to welcome all of you to another session under the policy track today, and to welcome you to our session that is entitled today G7 New Presidency, New Initiative, Learnings for the G7 Presidency in 2022. Which is also co-chaired by the Global Health Hub Germany. And it's really great to be here with all our distinguished panelists today and with our great moderator, Caroline, who will guide you through the session. As you know, the pandemic has shown actually how important global health is, and it has been for many years the top topics on the G7 agenda for many years. The COVID-19 pandemic has shown us how important this is to continue also to keep this focus in the G7 format, and especially now to keep the momentum on it. Germany's obviously G7 presidency next year offers exactly that opportunity to shape global health policy and to pave the way for further actions. As you know, on January 1st, Germany will take over the G7 presidency from the UK, who also placed health at the front and the center of their presidency, the G7 health ministers' declaration in Oxford, as well as in the Carbis Bay leaders' communique and the health declarations. For instance, and I think that's a very good achievement, the G7 committed to providing 1 billion vaccine doses to accelerate the rollout of safe, effective, accessible, and affordable vaccines, and the G7 leaders committed to supporting the manufacture of COVID-19 tools in low-income countries. As G7 president, we look forward, of course, to continuing and to place health high on the policy agenda, and would also like to continue engage in other formats such as the G20, and more importantly, also through the multilateral processes, such as those with the UN that are led by the World Health Organizations and others. So with the panelists today, we don't only want to take stock, we also want to discuss the pros and cons of new initiatives. And we also want to shed light on how Germany can shape policy outcomes in these forums in a sustainable way. So this just as an opening remark, I'm now very honored to introduce Caroline. And Caroline, I need some time here to introduce you because you have a really impressive professional track record. And Caroline first joined the Wellcome Trust in 2018 to lead actually the Wellcome's Germany's office. And then it was at a later stage even expanded to the entire European continent. In this position, you oversee Wellcome's activities and relationships, not only with the German and the European governments, but also with the science community and other partners. And you represent Wellcome in the German and European public. But prior to that, Caroline also led the Germany office of the Bill and Melinda Gates Foundation. She built the foundation's relationships, the activities, and grants portfolio with the government. She also served as an advisor to Bill and Melinda Gates, and she acted as a spokesperson for the foundation in Germany. Last but not least, she worked as a private sector specialist at the World Bank Group, and also, if I'm not mistaken, as an engagement manager at McKinsey Company and Partner. During this time, you led several consulting engagements in a diverse range of sectors, including healthcare provision and pharmaceutical innovation. Subsequently, she also managed the World Bank Group projects in the Latin America and Africa regions. I'm sure you did a lot more than that, but that's in a nutshell. I'm really looking forward to this discussion today, and I think we're all very privileged and very honored to have Caroline moderating this session today. So the floor is yours. Thank you.
Thank you very much, Mr. Zuber. You may see me blushing a little bit. That was probably the most eloquent and detailed introduction, so thank you very much. I'm also very, very honored to be moderating today's discussion. I welcome the audience here in the room and also on the screen. I'm very glad to bring together a very interesting, diverse panel of perspectives, of backgrounds for a very timely discussion, as Mr. Zuber has just said. I'm chairing the session not only as your moderator, but also because I'm co-chairing the steering committee of the Global Health Hub Germany, who's hosting this session. And the Global Health Hub Germany is a relatively young new network here that brings together actors in Germany that are interested in and active in global health. So it's really trying to do what the World Health Summit is kind of doing in a whirlwind of 3 days as a more sort of longer term engagement, bringing together global health actors from industry, from government, from philanthropies, from civil societies to really make sure that pressing issues of global health are discussed across the sectors. And thereby, I think, helping all of us to get a little bit out of our bubbles and really see certain issues that we all care about from all perspectives. This session is a very good example for what we're trying to do, bringing together the government, the science sector, civil society, and think tanks on this panel and discussing the G7. So today, as Mr. Zuber has said, we're focused on Germany's next big GX presidency, as we tend to say. As you know, Germany has a very impressive track record in previous presidency, bringing together the G7 in 2015, the G20 in 2017, and now being again the president and host of the G7 in 2022. As you all know, also in a context of a changing government, which is actually a very new factor for us, looking at the last many years for a G7. So we'd like to discuss today a little bit what is the G something format, and particularly I think today the G7 in this case, what does it lend itself to when it comes to global health? Is it the platform where the issues we all care about, global health, is best addressed? In which context? But also picking up a little bit on the fact that I'm sure is not only the case in global health, but big G7 or 20 summits tend to announce new initiatives quite frequently and tend to sometimes come up with new projects or rename things anew. And we're trying to explore a little bit also if that's a good thing, if new initiatives are the kind of thing that both the G7 and the global health community most need. So hopefully we'll be tackling a couple of these issues, especially also accountability. So now we have a great communicate what then type of questions with our very interesting panel today. Before that, I'd like to briefly introduce our panelists. I will start with our virtual panelist, Amanda Glassman. Very happy to have you here today. Amanda is the Executive Vice President of the Center for Global Development and the Chief Executive Officer of CGD in Europe. She's a senior fellow also with CGD, which is a fantastic think tank for anything related to global development, global health, and politics. She focuses in her research on priority setting, resource allocation, and value for money in global health. So exactly the type of things we would hope that come out of the G7 agreements. So Amanda, thank you for joining us and welcome. Here on stage with me, we have Dr. Dagmar Reitenbach. Dagmar is the head of division for global health in the Federal Ministry of Health. She's actually a lawyer by training and has had a career both in the Ministry of Labor and Social Affairs and now for many years also in the Ministry of Health. She's been leading global health in the Ministry of Health since 2007. So you can do the math, how many G7 and G20 summits she has actively negotiated and shaped. I think everyone who has had to do with the summits knows that Dagmar has always played a very instrumental role behind closed doors and before. So we're very happy to have you here today. Thank you very much for joining. And last but not least, we have Professor Dr. Gerald Haug. He is the president of the German National Academy of Sciences, the Leopoldina. As you know, as many academies of sciences, it has two major objectives here in Germany, representing the German scientific landscape internationally, but also providing policymakers with science-based advice. And that, of course, is a high bar to meet with big challenges such as climate change, the pandemic, and many other fields. Scientific advice is ever more important in policy. And thereby the national academies also represent scientific advice on the G7 and G20 fora. So thank you very much for being here with us today. Before we start the moderation of the questions, I wanted to also say that as we meet under these unusual circumstances, we are trying to be as interactive as we possibly can be. That includes that for our virtual audience, or those in the room who happen to be able to be physical and virtual at the same time, we have questions for you. And obviously you can ask us questions through a platform called Slido. There's a link currently displayed on the slides that you can see in the presentation. On that link, you will input a code. It's the code you see also on the slide. And with that numeric code, you can actually log into the very platform that we'll be using today to be asked and to ask you questions. The questions we are asking you are 2 live polls, and we will show the results throughout the discussion. And when that is the case, I will sort of go from whatever flow of conversations we have to make sure we bring the results from all of you in the audience in there. And at the same time, you can enter questions at any time on this platform for us. You can also like questions that are being asked. The most liked questions will show up on my iPad higher up. So you know how the selection process goes. And if you therefore would want to support someone else's questions, that actually helps me to see it high up on the list. First question is actually now online. So if you want to, you can go to the Slido page. It is a question that is asking you, in your opinion, how powerful is the G7 to make a difference in global health? You can rate that from a scale from 0 to 10, and we will get to that a little bit later in the discussion. So without further ado, I would like to start our discussion here. And I would like to start with you, Ms. Reitenbach. You have a very long track record in health policy, and you know how the processes really work. Given that G7 is not everything you do, you actually see global health evolving from the various sides of the spectrum. What contribution do you really think the G7 has? What difference can the G7 make to global health?
Mm-hmm. The G7 and G20 are fora that are value platforms for cooperation and dialogue. And the advantage of G7 is that decisions and coordination is happening much faster due to the small number of countries. So it's much easier to agree on concrete action or to achieve tangible results. The G7 include countries with high economic power, and they have a long-standing political relationship, so they know each other quite well. So, and if G7 address pressing issues in the global health arena, if they show leadership, agree on concrete action, and this really makes a difference. And measures that are agreed at the G7 level can also be rolled out in larger formats, such as G20 or even globally. And yeah, when preparing for a presidency, it's always to decide whether the presidency should start a new initiative or whether this presidency should continue with existing commitments. And yeah, Germany, as many of you know, is a strong supporter of multilateralism. Therefore, we always try to strengthen existing structures. We try to avoid duplication, avoid fragmentation. So continuity in a topic which was discussed at previous presidencies is a value for us. And there's the opportunity during the presidency to agree on concrete next steps. So Germany did not often launch new initiatives. So we did it in 2017 during our G20 presidency. And I think many of you remember this. There we launched the Global AMR R&D Hub because we felt the need to promote R&D in new antibiotics. So, and I stop here for the moment.
Great, thank you very much. I think that's an important differentiation, right? It's one thing to start a new initiative, let's say, for something that is actually already ongoing. It's another thing to actually spot a gap where nothing is happening. And sometimes, you know, giving the child a name and actually creating a process or a mechanism that doesn't exist before can then cause action where there actually wasn't any, at least not on the level of those nations. That's really helpful to differentiate. Mr. Haupt, from your point of view, what makes launching new initiatives at the G7 level interesting or helpful? Is that something that you have also observed, that many new initiatives are springing up? Would you see the world a little different?
I mean, the overall setting is encouraging new initiatives, and the world is changing. It's changing very quickly, so that's key. And at the G7, I can add to what Dagmar Reichenbach has said, it's an informal club without a clubhouse, right? That's very often an advantage. There's no legal basis, there's no secretariat, there's no official membership. And that helps to create momentum. And of course, the changing and rotating presidencies allow each presiding country to think very hard on the agenda and the group's priorities. So if you think of the changing world and the new challenges which became part of the G7 are my topic. I'm a climate person. The digitization has been a huge aspect, or global health, which came into that. It's all very complex, it's very multidimensional, and this is where we academies can provide a good impact, as we can provide substance, depth, right? Rational, scientific aspects. And if we think of the pandemic, I mean, I think it's an absolute miracle, and it was a joint global effort that we have vaccinations at that short amount of time. It's a very good example. The therapeutics, the diagnostics, so everything happened basically within 100 days, and is now widely available, but also the older aspects like fight against cancer or AIDS is very important. So I think that's the upside of the aspect. Downside, of course, is what, and again, I'm a climate person, I think also our recommendations make very often the final documents. But then when it comes to the decisions and to comply to also some of those intelligent recommendations, each country is very often act alone, and the impact could be larger. That's a clear downside. And that's probably the way international politics works. There's a lack of probably long-term investment and foresight, which we go through. So an upside are new initiatives. The downside is that they very often cover up the lack of compliance on the long term.
Thank you. Really important point to look at. You know, it's one thing to get advice into these initiatives. It's another thing how much can actually come out of that. So going from a high-level government agreement, which in the end such a summit is, right? Heads of states agree on a common language, which is hard enough to get to, and yet does that language in the end really translate into action? So that would be my question for you, Ms. Glassman. What are some of the outcomes of recent G7 or G20 initiatives that you would say, you know, potentially made a difference, or did the opposite? And maybe we would have been better off without them, if I could say so directly. Do you think these were or are effective ways to actually progress global health?
Well, I think actually we should take a little bit of a step back and reflect on how these summits are talking about fundamentally different issues over time. And the institutional landscape is it responds to that earlier situation, right? Which is when we had G7 in Glen Eagles, for example, it was about debt relief. It was about 50 billion in aid. It was about the global fund, always from kind of an aid and low and middle income country government perspective, and sort of what are the high income countries doing for the low and middle income countries. That was reflected also in Muskoka, right, with the global financing facility. These are two big G7s that yielded very historic and important transformations of the way that the global health system worked and the amount of money that was circulating there. But, over time, we're now facing global threats, and the agenda is different. These are global public goods. It started, of course, Germany's excellent initiative on antimicrobial resistance, extremely important, but far from an agenda that you would say is adequately addressed in any way. And now we're facing pandemic and climate. And these issues are existential issues. They are global public goods issues where we have a domestic agenda alongside a global agenda. So it's not, perhaps a logical evolution of the Sustainable Development Goals and things like that. But, I think it's important to think about when we talk about the value added of something new and what it is we need to deliver in these intergovernmental fora, we have to think about the nature of the problem is changing. And because the nature of the problem is changing, it's always going to be awkward because the G7 is only a part of the world, and crises like climate change and pandemic require the entire world to act. That said, we've seen a lot of action on the coalition of the willing kinds of activities. So, if we look at the G20's big hit after the financial crisis in 2008, confronted with national regulators of banks that were somewhat captured, they put into place the Financial Stability Board, because financial stability itself was a global public good. It's obviously national public good as well, but there were, incentives that weren't working quite right. So I think as we think about the upcoming G7 and of course G20 that ends, we'll see a statement from the members, I guess, later this week or next week. We're in this kind of incomplete transition from the old globalization issues to the new global public goods agenda. And I think, there are genuine gaps in the institutionality and financing for these big issues. And yet the existing agenda, the development agenda, the health systems agenda at country level remains just as important and possibly more important, because of course we've had setbacks associated with COVID-19.
Great, thank you. Really important point to actually differentiate a little bit between, I guess, the old generation of issues tackled. I'd say not all of them are also exclusive to the G7. They probably reflected a almost always positive outcomes, sort of, the pie is bigger than its part, or the whole is bigger than the sum of its part type of logic, that when the richest nations come together, good things will happen, which looks a little bit different when the richest nations confront the rather negative things that can happen because of their actions. But that all comes back a bit on accountability. So when these initiatives are being announced, when the communique has some language on what the G7 nations would like to address, how do we actually make sure that something happens? Question back to you, Ms. Reitenbach. How do you look at accountability? Is that something that you in a government position are being busy with, something that you see is coming out of, let's say, a 2017 summit, that you feel there is pressure to show that some of the things that were announced and created are followed through in the years that follow? Or do you see that something that's coming more from a different sector outside of government and kind of almost being addressed at you?
We are busy with it, but it's quite good that we are busy with it. So the G7 members have been engaging on global health issues for a long time, and they have been publishing annual accountability reports, and they include commitments on global health. And so the accountability reports play an important role and to have a look whether we are on track. And during our German presidencies, we have also placed a strong focus on working with the engagement groups, with civil society, with the youth, with science, with business, labor, think tanks. And these engagement groups, they contributed very valuable input in our presidency's policy, in preparing the declaration, and they keep us on track as well. So, which is quite good. And so both elements, the accountability reports and the engagement with the other groups, are important in this regard, and both linked to the accountability and the sustainability. For Germany, it's important to use our presidency to support globally inclusive multilateral processes and institutions such as WHO, which is extremely important for us.
We will get to the German G7 presidency in a moment even more. I'm also seeing some questions coming up online on that, so there's a lot of curiosity. But picking up on the accountability a bit more, so there's accountability reports, there's various formats to kind of get a sense of, is there a clear goal? Is the goal being met? Are we getting there? Coming back to you, Ms. Glassman, what you would say have been successful G7 commitments in the past? You mentioned some initiatives, big names that I think many of the advocates in global health know well, because they would go to governments and say, remember Muskoka, you promised to put X amount of money or action into whichever goal, we've set there. But were these that you've named also in your view the most successful ones? So have you come across other initiatives throughout the presidencies that you'd say this is actually a good blueprint on how the G7 can operate with an outcome?
I mean, I think those are good examples. Those are examples that created a lot more money in the system and create fit for purpose institutions to respond to the crises of the day, namely like the Global Fund to Fight AIDS, TB, and Malaria that came out of sort of the Gleneagles period in 2005. I think, the other thing I would say is there's an enormous amount of pessimism, obviously, around intergovernmental processes in this period, because we have seen a lot of announcements that are translating very slowly into, for example, vaccination rates in sub-Saharan Africa. And so the impatience is very large, and we're in a little bit of a pre-Global Fund feeling. If you look at what's happening in civil society, the kinds of words and tactics that they're using, very reminiscent of that period, where there's just an clear to everyone, but not clear what it is that the G7 could do differently, because the G7 is very good at money, first and foremost, because they are the wealthy economies. But this problem that we're facing right now is not only about money, although it certainly has a financial dimension, right? So they're looking for doses delivered. What is it? We've had a lot of announcements about doses delivered. What exactly is going to change over the next several months that will increase doses delivered? Or the last G7 that proposed a kind of pandemic radar. In any case, we've seen the recent establishment of the surveillance hub in Berlin with the World Health Organization. These are good examples, but they're quite sort of modest in size. They're not, the transformative solution that people want to see. They want this pandemic to end. So I think the other thing I would say is what is a successful outcome is one that has implementation associated with it, right? If we look back to the last G7, it just wasn't clear how the great ideas that were agreed were actually going to happen in the real world, and who was tasked with their implementation and follow-up. And I think one thing that the G20 sometimes gets right is that they task the World Bank, for example, to set up certain things, or to act on the infrastructure agenda as they did a couple of years back. And I suspect we need something like that. We need to task the big organizations to address the gaps and needs that are identified, and to set out a clear path forward. I think there's lots of agreement on the sort of high level things, but the tactics to get it done are less clear.
Thank you. Really, really helpful. And as you said, I think the UK presidency of this year is certainly an example where I think that a lot of expert input, engagement group input, and of course national input through the negotiations came in there in what was deemed necessary, given we were in the middle of the pandemic. And lots of actors have thought a lot about how to be better prepared or how to deal better with such situations. And the pandemic radar is probably an outcome of that, where there was agreement in the end to name something, but at least maybe others are better informed. I'm not clear to what extent that is now being followed through. In fact, there's a bunch of individual sort of building blocks that are now out there. The WHO hub here in Berlin certainly being one important one, but that is not a global surveillance system in itself, and probably neither are some of the other individual institutions to say. So there is a question a little bit on, how do you say that in English? In German, we have a saying where you have to kind of drill through the thick piece of wood, and that job really hadn't been done to really drill down into the complexity of what would a good surveillance system look like, which clearly isn't something that leaders aren't just negotiating in a back room, but to really think through. And that takes me to my next question to you, Mr. Haug. I mean, there has been a process over the last couple of years in which also scientific advice is being brought in through the S20 and the S7 to really get scientific recommendations into this thinking. How successful has that been in your view? I mean, do you see scientific input reflected in the agreements that G7 leaders come to? And is that going far enough?
Well, it's in the agreements when you look at the texts. But Amanda just said it, we don't have a knowledge problem, we have an implementation problem when it comes to global issues. And I don't want to talk about the climate situation, which we all understand. We go through the biggest cold revolution since the beginning of industrialization. So a lot of nice texts have been written, but we have not been very successful. Here we are talking about global health, and I mean the National Academies began this some 15 years ago, and it's actually a well-practiced, wonderful exercise. Became a tradition. We interact extremely well, and I want to give you two examples on where things did go somehow well, but probably also didn't, related to the pandemic. In the G7 summit in 2015 in Germany, there were two main aspects deliberated and well formulated. One was on infectious diseases and the antimicrobial resistance. We already heard about that. Threats and necessary actions, right? So the recommendations included, well, we need to accelerate research and production of new antimicrobial agents. I would say has not worked. Vaccines, if you look at the miracle of the mRNA development, which has clearly 5 to 10 to 15 years of fundamental research behind. I think it was a real miracle. Went excellent, and the diagnostics I think was okay. But there was also a recommendation that we need to install a global infection disease surveillance program. You judge. I would say it wasn't very successful. And we need to develop, and it was in 2015, a coordinated rapid response in the face of major epidemics. I would say could have done better. So there was this very prominent role, and then it was repeated, and it went into the leaders' communique at the G20 summit in Germany at 2017. And Leopoldina and his partners came together and wrote, I would say, a very clever but warning text of a global pandemic entitled Preparedness for Future Outbreaks of Emerging and Re-emerging Diseases. It needs to be urgently improved. As I think we've now, as we look back to the last 18 months, there was also space for improvement. So it's clearly another example that prevention and preparedness very often go unheard. And the second theme we had, and also there is huge space for action, and it needs to be repeated, about neglected tropical diseases. It was both, in particular in 2015, was a strong note. So I would say things have happened, but there's still a lack of affordable and accessible treatments in many low and middle income countries, particularly in the low latitudes. So I would say on a positive note, yes, things end up in the communiques. There's then, as I think all have highlighted, some implementation issues. But I think as and you've said that, we'll continue with some of these topics. I'm very optimistic for the next German G7 presidency that we can build on the past G7 processes, but I think the world has learned a lot during this pandemic, and I positively go forward with that.
Great. I think to also bring, some of the historic successes in there. Ms. Glassman, you said that, the G7 tend to be good at donating money or, coordinating mechanisms where money is urgently needed. And to be clear, that's the case often in global health, because luckily there is a landscape of very capable actors, right, that have been set up over the last 10 to 20 years to tackle many of the issues that we worry about globally. So in 2015, for example, the replenishment at the time of the Gavi vaccine alliance was sort of under the auspices of the German G7 presidency. It wasn't something that showed up in the communique as we managed to get to $7.5 billion for Gavi, but it was almost in the patronage of then Chancellor Merkel and the government to support and host that summit. And I think while that's not the classical outcome of the negotiations, it is quite important that G7 presidency governments are willing to almost take things under their wings, so to speak, or in their responsibility to say, in this year, we have a special status for good reasons. We are negotiating with many governments, and that gives us a voice and a reach that with that hat on, we can do good for an important process. We can collect often money, but not always, also political support for, whether it's the Green Climate Fund, whether it's Gavi, whether it's, CEPI was launched, I think, at the World Economic Forum in the year of the G20 presidency of Germany. Again, sometimes that's timing, sometimes it's, things coming together, but it doesn't matter. And I just wanted to point that out because that isn't the classical G7 negotiation outcome, but I think it's an important responsibility that sometimes hosts take on and are willing to also contribute to. So unless sorry, Amanda, sorry, I thought you were saying something. Did I just interrupt you?
I would love to say something, but I mean, I think, what you're suggesting is an important point. And that is that, if we think about this G7, there is need for kind of a package of replenishments and assessed contributions. So I think that is something to think about. The money piece is really, really important right now as well. But I wanted to say something else about the institutional part, but I'll let you, I think that you're coming to that in your next round of questions. So thanks.
Great. Unless there is a result from the current poll. So I just wanted to check because that might be a good quick moment to take a look at that before we move on in the conversation. So we're just getting, okay. How relevant and powerful is the G7 to make a difference in global health? So it reassures me that at least a very small minority finds it not at all powerful. There might be a little bit of self-selection given that we are the World Health Summit and people are dialing in who are interested and engaged on these issues, but it is an important reminder not everyone is convinced. Ms. Reitenbach, how do these results make you feel? Do you think that, is that resonating with you?
Yeah, I think that 50% or more than 50% have the feeling that G7 is very relevant and powerful. So I think, yeah, it puts the pressure on our shoulder really to try our best to achieve good results next year.
Great. So I think for those in the audience, there's going to be another question for you that's going to be put on now, and you have the next half an hour to think about it. What makes an initiative launched by the G format, so G7 or G20, particularly successful? We'll take a look at your ideas in a moment. And in the meantime, I would like to shift gear a bit more explicitly on the next year and obviously the hopes, realities, the wish lists for the German presidency. I thought I'd start with sort of with the other panelists so that you, Ms. Reitenbach, can respond last after you've heard all the wishes and hopes, at least from the panel. I'm sure we get into this later with the audience another time as well. So Ms. Glassman, if I can start with you, from your point of view, what could Germany push on? What kind of progress could Germany as a G7 president next year push on to really make progress and change important issues in global health?
Yeah, well, I do think, we're in the midst of a historic crisis. It's really without precedent. And there is a need to think about both global health, but also development and economic growth around the world, which is really important for poverty reduction and reaching the other kinds of human development goals that we would all like to see. So I do think that I would like to see Germany also use the entire toolkit it has when it thinks about its commitments at the G7. So it's not just health narrowly defined. It is also the whole system of the international financial institutions. That these are the mechanisms that we have to support global public goods now. And I know that Germany has been very outspoken about the need to finance global public goods like climate risks, like addressing conflict, and like pandemic more effectively at the multilateral development banks. So that is also a place where the other members of the G7 own most of the shares. And so we need to not just think about it as, oh, it's our little global health organizations over here, like they're not little, but like Gavi or CEPI, which are very, very important. But it's the whole family of institutions. And ideally, we would try and think about how these institutions work together more effectively. Some have more money for certain kinds of activities. others are more mission oriented for certain kinds of outcomes. Can we put those ideas together in some way? And so this idea of kind of a package of replenishments, starting with the World Bank's IDA, which is coming up in December, but obviously CEPI, there's a whole agenda there around, a variant strategy, vaccines that are easier and cheaper to administer, and also, like a pan-coronavirus vaccine so that we can be prepared for the future. Likewise, Gavi delivery of vaccines and the Gavi family, it's a partnership, right? So there's UNICEF and all of that. And then the regional institutions that are out there and that can provide a lot of value added. So I hope that Germany will use the entire family of institutions, of multilateral institutions that are out there to advance. But I also think we have to realize that, some of the global health challenges that we face, like pandemic risks, like antimicrobial resistance, are much more than the health sector. And so thinking about, agriculture, development, and economics, and all of the line ministries in every country that deal with this, meaning an interagency process to try and get a better response in place for the future. I think the other thing that I would like to flag is around checks and balances in the system. Intergovernmental organizations and multilaterals have a really important role to play, obviously, in shaping norms, standards, making governmental commitments, channeling the bulk of finance. But at the same time, we've seen during this pandemic the importance of an independent scientific voice and data to be able to take decisions. And that sometimes does not naturally come out from intergovernmental organizations, no matter what reforms we might imagine for them. And so I think, one idea that we've been talking about is sort of a corollary to the intergovernmental panel on climate change. We should have the same kind of thing on pandemic risks and AMR. We don't understand this risk well, we don't measure it well, and we haven't engaged the full scientific apparatus of universities and civil society organizations to look at this and serve as checks and balances. And, by the way, when we think about strengthening epidemiological surveillance at the country level or mortality surveillance, that's really not just a job for government, although government has a huge role to play. It's also about other entities that are there. And, if we think about like the respiratory, like the flu epi surveillance system, it's really done by a network of university-based volunteers. And I mean, this is no way to operate. So we need different kinds of mechanisms. It's not easy for an intergovernmental organization to provide finance into these universities and civil society organizations. So I think we should think about that. And I think finally, there is still the need to bring in the other sources of income and to finance this activity differently. People have talked about it. Norway has made a specific proposal, which is that, these are global public goods. They're not about aid anymore. These are about our sort of mutual security, and therefore they should be financed differently and not counted entirely against ODA or classified as aid. I don't think we'll get to that level of agreement very soon, but I think it's an important issue because otherwise what we do in these spaces takes away from other important priorities at the country level. Thanks.
Thank you. Hugely important point. The one at the end in particular, because it takes us away, I think, from the usual global health dynamic, right? Where there is luckily donor willingness if the constellation of G7 leaders aligns well and so on. But going beyond the ODA, I think logic has especially been clear now in the pandemic is important, because otherwise there will be a competition for resources and you have to trade COVID vaccines with routine vaccines for small children, and you have to trade off health systems capacity to do COVID vaccinations with health system capacity for malaria, tuberculosis, and so on. And these trade-offs aren't often talked about, and that's really where going beyond ODA is incredibly important. Mr. Haupt, what is your wish list? What are your requests, your vision for next year's G7 presidency by Germany, and how do you the Science 7, so the science input that Leopoldina is leading on, what are the plans for that to support the agenda?
I mean, there's a kind of an obvious double challenge. On one side, it's the health aspects. With an ending pandemic, there will be still a major issue next year to end the COVID-19 pandemic. and then to look beyond that to better prepare those future health emergencies. We've already heard a lot about vaccine development that worked well. We at the moment have a paper which we're about to publish on antiviral substances. So we try to bring that in, and that needs to be also, of course, complemented by the situation of new innovative antibiotics and then approaches on antimicrobial resistance aspects, right? So we also plan in preparation to have an in-depth paper on that. And then after the COVID pandemic, I think, and this is a big word in your world, is we need to truly embrace a One Health framework to have the measures in hand against zoonosis, right? I mean, they will not go away; they will come back, and it needs to have a global implementation on all levels, right? And then there are a lot of other non-communicable diseases which we have to continue work on: the cardiovascular aspects, the cancer aspects, respiratory diseases, diabetes, right? So I think there's very much to do, and that should be part in the G7 discussion. And then the other one is we need to get serious about climate change, right? We had past G7 summits, and the leaders would basically take the ambitious targets on climate. Also biodiversity is a big issue, but these were words, lovely papers. Little has happened. So we need to focus the presidency on the implementation of concrete measures on how do we reach climate neutrality, right? And really the implementation aspects. So of course, it's the energy system which we need to address and how to decarbonize it. But the sharpest knife we have, and we know it, is carbon pricing, right? And without carbon pricing, I think we can just forget the 2-degree carbon target. And that's gone, this is my expertise, in 10 years, right? Paris is gone in 10 years, full stop, right? And if we don't apply some sharp knives as carbon prices with social innovation, this is the economists, multidisciplinary aspects from all of us, they're very clear what to do. And I think this is where Design 7 will again provide lovely pieces of text, but we hope for then some serious steps also in implementation.
Thank you very much. So a long list. I've heard using the entire spectrum of instruments of, organizations to partner up with, of funding mechanisms, ensuring that we acknowledge and move from where we are right now in the pandemic. One Health as a big point, and then of course climate change is an entire almost additional universe, some of which maybe you will be able to shape, some will be shaped by other ministries, of course, in the government. But in that small list of wishes, where do you situate right now, where you and the government are? How much has been planned, given we're in a context of a changing government? What is your timeline? What are some of the concrete next steps you're working on?
Yeah, thanks to the panelists for these very good recommendations to our presidency. I know there's a huge interest in our presidency. So we had the elections at the end of September. At the moment, the negotiations on the coalition treaty are ongoing. So we are waiting for the new government, and the new government will decide on the priorities of our presidency. However, with the ongoing COVID pandemic, we are fairly certain that health will be on the agenda. And one of the priorities currently, the most pressing topic in global health include ending the pandemic and the implementation of lessons learned from this pandemic. But of course, the new government will decide and take the decisions. But we are very interested to get your views. What should be on the agenda of our presidency? So we already asked and received a lot of very valuable contributions through the Global Health Hub Germany. And we are very keen also to hear from our audience today what you would like to see on the agenda. Please feel free to share your views on this with us.
Fantastic. So I'm just giving this again to the virtual audience. Feel free to slide all your ideas. I'm happy to sum it up. And obviously there's other ways that we can pass this on in writing as well. All of the ideas you have. We will also soon turn to the questions from the audience. I'd like to do one last round of questions with the panelists, and I think we still have over half an hour to ensure we have enough time for questions from the audience. I'll start with you, Ms. Glassman. Again, looking at other presidencies, previous presidencies, what do you think we can learn? We've talked a little bit about things that maybe haven't been addressed as concretely as they could be. You've mentioned some examples that were particularly helpful in the past. If you'd say what could and should the German government learn, take away from maybe the last 2-3 years in approaching this, particularly, as you said, recognizing that the nature of the challenges that the G7 should be tackling isn't entirely more in their control. It's challenges that face everyone and don't only face the richest nations.
This is a hard question. I think, yeah. Well, I just want to say again what the other panelists have also underscored, which is implementation. To stay away from beautiful ideas that that don't deliver in a reasonable time frame, or in a way, and therefore to consider what it is that the G7 has more control and influence over. So when I think about the role of the World Bank, for example, in providing global public goods or financing global public goods in low and middle income countries, that is a place where the G7 has an enormous amount of influence and impact as major shareholder governments. And it's also a space where it's multilateral, and both contributing countries as well as borrowing member countries are there in the governance mechanisms. So I hope that sort of that piece is understood. And likewise, there has been a certain comparative advantage of the G7 governments, a specialty, let's say, in some of these big global health entities that exist. Obviously, Germany is very committed to the World Health Organization and its way forward. There's not much consensus on what a pandemic treaty looks like, on what kinds of reforms are needed at the World Health Organization. And the World Health Organization has its own, governance process. But, if the G7 came together and said, we're willing to increase assessed contributions against several key reforms, you can imagine that it would happen in the real world. So I think it's sort of thinking about that sort of very concrete next step, what needs to happen. Likewise, sort of financing some of the global public goods in pandemic preparedness and in mitigating climate risks. That is also something where the G7 could have an enormous role in sort of organizing things a bit better. I mean, I think what probably is not going to be successful is like major reform efforts, because those are difficult. I've never seen a G7 that undertakes the major systemic reform that a lot of people talk about. So I think we just have to be very strategic in terms of what it is that the group works on.
Great, thank you. So time-bound, realistic outcomes. Maybe also a little bit the courage to take up things that have been thought about before, that hasn't have to be an entirely new thing. Some of these things only need that last little step of support to be successful, and the G7 lends itself very much to do that. So that's a very important point. Mr. Haug, how do you think that the G7 can best benefit from groups like the S7, but maybe as in Science 7, but maybe also Civil Society 7, Youth 7, Women 7, Labor 7. So there's all these groups that so Hettenbach mentioned before that are providing advice. You've just said there will be another beautiful paper. So do you think that's the best way that this advice is given, or can you also think of other ways that you would hope these groups can engage and actually really shape some of the content of the G7, and in which way?
Well, it's a German tradition to be somewhat a front runner to include major external stakeholders. Mm-hmm. You've just named it. I think this will be continue. That's important for societal participation. That's obvious. So what we hope, and doing the Science 7 is, and expect also from that presidency, is that there will be an open dialogue on critical points, which should be addressed and discussed. However, in our case, always in a factual manner. Right? Substance is key. And then we should engage in a meaningful way with those groups on priorities and concerns, and then hope and do our best that the science-based policy advice, rationality, is taken seriously. And this is a collective task which the academies can perform. And then we would hope that, and we've talked it in the previous point, that we come to some rational implementation aspects.
Wonderful. I would break here for ensuring we have some audience questions, which I'm sure we'll have a lot of follow-up for next year's G7 as well. Quick question, if we have the results of the second poll already. Let's see. Okay. What makes initiatives launched by the G formats particularly successful? It is, I think, reassuring for everyone in the room that accountability is a very, very often named concept there. Concreteness, I think that's pretty important as well. Having focus, being clear about what you're trying to achieve. Political will, absolutely. And also implementation cooperation, which may go hand in hand. So there's a couple of concepts: inclusiveness, sustainability. I think the interesting thing is some of these aspects that the audience here is mentioning, I guess some are about the what and some are about the how, right? So concreteness is really important, and having an agenda that actually is focused, and to be so that it's pretty clear for everyone what is in focus and what simply isn't, even if people might disagree. Whereas accountability, implementation, political will, equity, there's a lot about the how. How do we go about it? Who's heard? Who's included in implementation? So I guess we keep these concepts in mind. Also, as we look at, the G20 summit this week, be interesting to see how that performs against these criteria. And there's obviously a lot of other ones. I think narrative is mentioned is really important. How do we talk about this? Narrative has a lot to do with trust, which will come up in the questions from the audience in a moment. Are there any concepts, any words that surprise you? Anyone on the panel? Something you didn't expect, something you disagree with? Does not seem to be the case. In that case, I hope it's a lot of good inspiration to have a couple of North Stars to say this matters. This is something that maybe our engagement audiences also are trying to look for when they hear what is going on in Germany next year. So thank you very much to the audience for participating in these polls. I think it's really, really interesting. I'll now turn to a mix of in the room and virtual Q&A. Bear with me. This is me trying to moderate hybridly at its best. I will start with some questions from Slido. I don't know what the process here in the room. I think people who will want to ask a question, probably raising their hand and someone coming with a microphone. So for that to happen, there's time while I ask some virtual questions. So a couple of things on the German G7 presidency to start with, Ms. Reichenbach, and you kind of know what the audience is most interested in. So which priorities within global health, if at all, already a little bit salient, recognizing you can't predict what a new government will do, but still, are there any topics that you think within global health are already likely? When and where will the summit take place? And how does the government actually organize a G7 presidency in such a short time? I mean, we all hope we have a government by December. G7 presidency starts in January. If we're unlucky, maybe the government is, ready by December 30th. How does that play out?
So we have 1 year. So the presidency starts on the 1st of January next year. So I'm pretty sure that we will manage in time to make the final decisions on the priorities. And as I mentioned before, having to deal with the pandemic. So I'm quite sure that health will be on the agenda, and all the other topics will be decided by the new government. So I'm very sorry. At this stage, I cannot predict any topics.
Okay, I will predict that you will be a very effective mover and shaker behind the scenes to help the new government make happen what we discussed today. One more question that I think, Ms. Glassman, if you could comment on, there's a question that says we talked a lot about trust, but isn't the G7 format actually reinforcing the mistrust? It is this format of rich and mighty nations ruling the world. What do you think about that? To what extent can the G7 actually establish or reestablish trust?
Yeah, and I think delivery is the response, the way to build trust. So if doses are delivered in a timely manner through AVAT, through COVAX, through the bilateral deals that governments have struck with firms, that will restore some of the credibility that we see as, and it's not just the G7 or the G20, it's all of the multilateral system really that's in crisis. We have not been able, there have been some miracles, as our colleague has pointed out, which is the quick time to a large number of very efficacious vaccines that save lives. The part that is going less well is the delivery piece. And it's really, I can imagine that as a policymaker today, sitting in a G7 government, that you are really under a huge amount of pressure. So I think, delivering on that is really the answer to the trust issue. Now, no one thinks that the G7, I don't think the G7 governments themselves think that the G7 is representative, but it is, a club of wealthy democracies that are generally aligned on some of these issues and the sort of goals of the multilateral system. And I think the question is, can they convince the rest of the world in the UN, in the G20, in the G20 plus, in the regional institutions? And I think that's about the power of the ideas. How good are the ideas? How well have they been discussed and consulted with the different stakeholders in the system? You can't make everyone happy, but it's a very powerful. I guess I'm not totally pessimistic, because if you look at like the global minimum tax rate, that's a quite important achievement of the. I guess that came out of the G7 in June 2021, and it's being discussed by the G20 now. Surely that's hard. That was a very hard reform and a hard item to agree, and yet all of the governments, the finance ministries are sort of in agreement that they would do them themselves. And it sort of speaks to the issue of the current agenda, which is that what I do at home domestically affects the global situation. And if we act together, we can be more effective. So I think most people would view that action as quite a good sign that these systems can work.
Great. I'd like to put that question also to you, Mr. Haug, in a different way. So creating trust. Now we have these processes in which eminent institutions feed input, whether it's Leopoldina through the S7 or maybe other fora. How do you ensure that the world out there, the citizens, perceive this as a process that is potentially also on behalf of them, that it's not entirely just certain institutions that have the privilege of feeding in this input? How do you source your recommendations? How do you feel you're doing a good job in being as encompassing or inclusive as you can?
What we can do as the scientific, the academic community, we can bundle knowledge and provide that bundled knowledge from all disciplines into an understandable, well-communicated format, right? And just also to what Amanda just said, it's delivery, but if you also think of the global innovation and the power also when it comes to green technology, the vaccines we've said out of the G7, right? That needs that very deep understanding and substance, right? That the high appreciation I have for citizen science is cool, right? But to draw down a vaccine, which we scientists done in 2 weeks, basically, is 20 years of background and an in-depth knowledge And if you think of the combined potential of the G7 or the G20 and plus and whatever, this is what could make a big difference. So when we come from the innovation to the deliver to implementation, we can also draw very optimistic pictures for our future. And this, I think, what I was a little disappointed in the previous picture, the science was kind of the sidekick there on the left side, right? So I think we probably also have to be self-reflective and see how we can do in the science communication an even better job, because without that substance and depth, there's no innovation, which is so much needed on many of the topics we've discussed.
Great. Are there any questions inside the room? There are. Would someone bring a microphone just so that members of the audience virtually can also hear you? There's 2 questions. First one was over here, second one over there.
Thank you. Yes, my name is Jürgen Brandstetter. I'm the Austrian representative to the Global Digital Health Partnership, which is an informal partnership of 30 plus countries plus WHO and OECD. And by the way, 4 of the countries are G7 members. So I'm not sure if I have a question or more a plea regarding to what the next presidency should take care on. There was a very interesting passage in the Oxford's declaration of the G7 health ministers, where they explicitly mentioned digital health as an important topic for the future. I work in the area of digital health standardization, and we see there is a lot already working, but to be honest, we are still at the start here because of lack of standardization and of the cooperation between the users of these standards and the creators of these standards. And what was received very well was this passage in this declaration, because we saw that the governments finally recognized that there is a need of cooperation in order to increase the speed to get these things into the field. And I'm not sure if it's a question, but it's a plea that the next presidency of Germany, please take that string further and invest into digital health, because digital health is kind of the intelligence of health. And from our perspective, it is a bit, let's say, under-invested into, especially when it comes to times like within COVID, where we saw everywhere that digital communication was kind of not enough, to be honest. Thank you.
Thank you very much. I think there was another question, possibly, on the other side of the room. Over there.
Yeah, thank you very much. Very fascinating discussion. I work in WHO for antimicrobial resistance, so I'm very happy that the Leopoldina is recommending to the German government to keep AMR high on the agenda. And I wanted to come back in 2015 for us from WHO. It was really groundbreaking that WHO that Germany put AMR so high on the agenda. And I disagree with Dagmar. It is not easy to find agreement in the G7. It is very difficult because, as you said, Mr. Haug, it is on R&D, it is still on the agenda. And I'm in this G7 health working group that is led by the UK at the moment. And we are still on the R&D issue around antibiotics. And it is not easy. And I think the fact is accountability. I think this is super important. It needs to be concrete and then needs to be implementation. But as you said, if there's no clubhouse and nobody who manages the clubhouse, then there's also nobody who's really following up on implementation. And that's where I want to really, we were very happy with the German presidency because Germany followed up on its commitments. I remember when Dagmar came to us and said, you need to do a bacterial priority pathogens list. And they followed up, they forced us to do it, they gave us the money and we did it. And we set up GARD-P, which is a foundation that is developing antibiotics, and Germany put 50 million in the foundation. And then some other G7 members followed up. The US created CARB-X, Germany again put money into CARB-X. But you can see that this is not all 7 G7 members put money in these institutions. And so not every G7 member is following up, but I really do think that Germany is one of the few where there is not only a commitment on the paper, but there's also money following up. And that is really important, because if you only put it in the paper and there's none of the G7 members is really going to the institution, as Amanda said, going to the World Bank and saying, the World Bank, you need to do this now, and you need to put money behind it, then it's not going to happen. So I think I really hope that this is building on the 2015 agenda. And I would be interested, Mr. Haug, you mentioned AMR. So what specifically do you want to do to have the G7 focus in AMR? R&D again, or infection prevention and control? What aspects of AMR do you think the G7 should address?
I mean, I'm obviously not an expert on the field. We have outstanding colleagues who think very deep about that. Lothar Wieler is known as the Robert Koch Institute director. He's a zoonosis expert and is one of those who is, of course, advocating the R&D. That's one of the aspects. But the other point he and colleagues are making, and we just founded a new section, Global Health, is that with our change in living conditions, right, the system between animals and man, everything is tightening up, that we not just produce new antibiotics, but also think very hard on the fundamental system, again, to prevent those outbreaks, which would then be very hard on the microbial side. So I think that could be one of those papers which we start to think to prepare now for the next year's summit within the Leopoldina, and it would go far beyond just the R&D and new antibiotics.
Great. If I could actually ask, if that's okay, if the microphone could go back to Peter Bayer, because I have a question for you, if I may. I'm just picking up because you obviously have also quite a bit of experience on behalf of the WHO of observing and being part of background negotiations, of having, of course, also expectations to what the G7 can do to support the work. So you've heard strengthening WHO is definitely something that Germany has been strong on. The G7 often, not always, have been strong on. So from your view, what are things that the G7 presidency and the G7 themselves in the next year could do to be actually meaningfully helpful in strengthening towards WHO? What are the things for an organization like that is within the UN system and clearly has a lot of variables to deal with? What is actually really helpful to come out of such a presidency?
I think that's a very broad question, far beyond my area of antimicrobial resistance. But I think somebody mentioned financing WHO. And that was already after the first big Ebola outbreak. I remember we had an extraordinary session of the executive board. Germany had suggested that the assessed contributions should be raised. And then overall member states at the assembly could not agree on this. Mm-hmm. And I do really hope that this time it's going to be different. And that is where G7 countries certainly can take a lead, because as you said, they are the club of, let's say, the rich countries. Mm-hmm. So if they commit, then hopefully others would follow. And that is, I think, something which really could make a difference. And then in some of the areas, I mean, AMR, some people say this is a rich country's business. It is not. The disease burden is the low and middle income countries. So I really see also the G7 that it's not about aid, but it's about a global problem we can do together. And if the G7 countries would lead, for example, on goals on reduction of use in antibiotics in animals, that would be also, it would be very concrete, it would be implementable, you could follow up, and yet they could also say, we did something, now everybody should do something. And that is where this leading by example, I think that is what G7 could do if they take commitments and then hope that it, others follow. And it's not only in the interest, of course, of the G7, but of the whole world.
Great. Thank you very much. It's always good to have concrete examples, understand a bit better the perspective of other organizations. I have one more question or set of questions from the virtual pool. And then I just wanted to understand if I'm wrapping up or yes, I thought so. That's well, will be great. So just making sure I leave enough time. Last question I have, and I think Ms. Reitenbach, you will have to be asked about the process one more time. There's a bunch of questions from the audience trying to understand how do the ministries within the German government ultimately choose the priorities for the G7 presidency? So, you know, we've now heard a long list of wishes within our field of global health. There's, of course, a long list for climate change. I'm sure that many other ministries have agendas and have processes that matter that they would like to see. So how do you choose priorities, and also how do you work across ministerial lines? How do you work together across ministries to make that happen?
So so we are in the process and proposing topics to our Sherpa team in the Chancellery. So we are working closely with the other ministry, and my colleague from the Ministry for Research is here with us. So we are working with the Ministry for Economic Cooperation and Development, the Ministry for Agriculture, and others as well. So then we try to identify pressing issues, propose these topics, and yes, health is always in competition with other topics like finance issues, like climate change. So, and in the end, we to identify concrete proposals which could be the outcome of this presidency, could help that yeah, this topic will be chosen by the new government. So, and then we have for us, we have the health track where we come together with our partners from the G7, where we include WHO and other international organizations. And then we discuss these topics and try to find consensus on next steps. And so coming back to Peter's comment, so in the G7, it's much easier to find consensus if you compare it to 194 countries at WHO. So yeah, it's not every topic is easy to find consensus, but in general, it makes it easier, this format, yeah.
Great, very reassuring to hear that actually implementability and outcome is a criterion in choosing priorities in the first place. So that's great. I think we've covered a lot of ground with a wonderful audience online and here in the room. So before I hand over to Mr. Zuber, who is wrapping up and closing us off here, I also wanted just to remind you, this is the policy track here at the World Health Summit is new. This is the first time it's happening. It's a new way of both focusing on political issues, which of course the World Health Summit has done, but not as intentionally, I think. And this is really an effort also by the German government to make this conference more accessible, both for policymakers and for actors to get in dialogue. So please, if you can, there will be a little poll online. If you have a minute to fill it out, that will help us and everyone involved to make it better. And thank you very much for, I think, a very, very rich and wide discussion on many, many aspects of what makes the G7 presidency successful, what the wish list looks like, but also, you know, clarifying again, and especially thank you, Ms. Glassman, for that perspective, to kind of looking back and looking forward and really saying, okay, we have a track record here, and some things lend themselves to more success than others. I think that's an important one to take on the line. And so without further ado, Mr. Zuber.
Yes, thank you, Caroline, for the wrap-up and for the final remarks. And thank you to all the panel, distinguished colleagues. I think it was a great discussion. What I learned today from this session is we really talked not only about the value added of new structures in the context of the G7 or existing structures, we also talked about pandemic challenges, what it really needs to better them for the future. But we also talked about implementation, and that really struck me, because if one thing became clear, everybody felt very strongly about it, was implementation and accountability, so that intentions actually do not evaporate into vacuity or insignificance. I think that is really what people expect from us, what the public expects from the G7, concrete measures that come out of the commitments. And a lot of good remarks have been made also with regards to WHO financing. I think indeed Germany, as the #1 donor country to WHO, of course, encourages sustainable financing of the WHO, but that also goes hand in hand with program countries, because only there you can then also really secure a country ownership, which is key if you really want to address global and public health issues. So I think we all took away a lot of food for thought. I know Dagmar was a very sought after person today, and so were the other panelists, and I thank you very much and wish you a very good day in the end of the session. Thank you very much.